We all spend less time outside as the temperatures get colder, and when we do head out, we bundle up from head to toe. That means we get less ultraviolet light from the sun, which may cause some problems with your feet. Welcome back to the show, Chattanooga podiatrist. We enjoy it when he's on so much. Dr. Ira Kraus. It's good to have you here, buddy. I didn't realize that. And of course, with the with the dry heat, it can cause problems in the house as well. You don't realize how effective the sun can be on your body.
Well, the good thing about the ultraviolet light is that actually a lot of our treatments are revolved around the fact that ultraviolet light does healing things. So can you imagine when you're inside bundling up, you're inside your shoes, you have your 3 pairs of socks on because it's freezing, your feet are sweating, they're getting moisturized, fungus and bacteria are growing rampantly in your shoes, makes a huge difference on how you take care of your feet.
Let me just say, we all go to the, I mean, it's just inundated with commercials, and you say we are just really being ripped off by what we're buying at these big box stores. You can go to a podiatrist. If people have never been to one before, what, you're saying this stuff doesn't work?
Well, here's the thing. I think that when you look at over-the-counter remedies that are non-FDA approved, you have to look at what kind of results you're getting. And I think that everybody's looking for products that they think are cost effective. I have patients that come into my office, Jed, that have literally spent $200 and $300 on over-the-counter products before they even come into the office. So what I try to do, all of the over-the-counter products that I use usually have the seal of approval from the American Podiatric Medical Association. So they've been looked at and they're tried and true as far as getting results for patients.
Let me ask you, for people who have no idea what a podiatrist does, what is a podiatrist? And then we're going to show some of these products. And listen, insurance covers podiatry visits.
Correct. Podiatrists can treat and diagnose and treat deformities of the lower leg, ankle, and foot. We can do surgical treatment, we can do non-surgical treatment, we can do sports-related injuries, we do diabetic limb salvage, we do ulcers, we do simple ingrown toenails, we do corns and calluses. You name it, we can do it.
And about you, you've got the respect and you've got the privileges of every major hospital here, so you get to use their operating rooms. We start over here on the viewers' left.
Right.
Let's talk about this, and it's fungal foam.
Right. What we have is we have a couple of different things. On my far right is something called Formula 3. It is a topical antifungal for nails. Many people are afraid to take the oral medication because it has side effects with the liver.
Right.
So what happens is this is a topical medication that we've had very, very good results with. Next to it was a product actually that's just been recently developed, and I actually can't keep it in my office long enough. It's called Fungi Foam. It's actually made of the same antifungal products as the toenail polish, but it also has an emollient to soften the skin, and it also has an antipyretic because a lot of people have itchiness with athlete's foot.
So that's got to be prescribed, is that correct?
No, it's an over-the-counter product that has 3 medications in one that we dispense at our office.
All right, let's go to the next one here.
The other one is something called Mycomist. That's how you disinfect your shoes. I'm going to give you a simple question, Jed. Let's see if you get it right. If you treat athlete's foot or fungus nails in your shoes, and you know that it grows in your shoes and you don't disinfect your shoes, what do you think is going to happen?
It's going to grow back.
Exactly. So that's why you have to disinfect your shoes in the process. The other thing I have is, I think they're really nice. I have antifungal nail polish for women. What happened is, this polish is made with tea tree oil. It's not made with talnaftate, and it's not made with formaldehyde, so it doesn't yellow or discolor or dry out the nails.
Which is common if you use regular nail polish.
Correct. If you wear nail polish 24 times 7, your nails are going to turn yellow. This is going to stop your nails from turning yellow because it doesn't have those chemicals in it.
So in other words, it's healthy nail polish.
Correct.
All right,
exactly.
We're getting the big rap, unfortunately, but let's go ahead and show these
I just bought a couple of pair of custom over-the-counter orthotics. These are something that, to me, are almost as good as customs. I have patients that come in and buy Dr. Scholl's products or over-the-counter insoles that are not fitted for them. We have an over-the-counter insole that we fit for them. I know I got to wrap up. Diabetic shoes, one of the best programs out there.
They're not ugly.
They're not ugly at all. They're made for patients to prevent ulcerations, reduce amputations, save limbs, and save lives, and that's what we do.
Listen, how come you've been gone for 4 months?
Because you don't have me back. You're too busy for me.
You need to talk to Julie. Julie will book you.
We're going to blame it on Julie, and we'll see what she comes up with.
Ira Kraus, you take care of feet better than anybody, buddy. All right, here we go. Advanced Footcare. I don't know, 6, 7 locations now?
5 locations.
5 locations. 698-1966. That's the main office number in Brainerd. AdvancedFootcareCenters.com. Dr. Ira Kraus, he's got a foot fetish, and that's good. 698-1966. All the best to you, buddy.
Thank you, sir.
Thanks, man.